The mouth truly is the gateway to overall health. There have been a lot of journals, a lot of articles published in medical journals, even on the human side of things, dealing with periodontal disease and all of the effects of periodontal disease. So when we talk about, the overall health of our horse, it only makes sense that the horse needs to have a healthy mouth in order for everything else to function properly. That's the very beginning of the digestive tract, really. That's where everything starts. And if the mouth can't do its job effectively, or it's creating problems for the horse and other parts of the body, the horse is going to have a tough life. Horses by nature, horses are a herd animal. By nature, they are designed to hide pain. The last thing a horse wants to do is show pain. It's in their DNA. To be stoic, to be tough. And that's one of the things we love about them so much. But I open horses' mouths all the time, and I see incredible ulcers and sores and loose teeth and issues that are going on in the mouth. And the owners have no idea because the horse has been hiding it the whole time. And so sometimes that comes out in a behavioral issue. I see horses who rear, or they flip their head, they won't take the bit. The list goes on and on and on. And oftentimes the source starts with the mouth. I've had a lot of horses I've looked at over the years that have had problems in the mouth. And when we talk about the overall health of the horse, I can't tell you how many people call me back or email me a week or two after I've seen their horse and taken care of issues. In a lot of cases have put them on Key Equine supplement, and they call me back just thankful. The exciting thing to me about Key Equine supplement is two things really: the ingredients, no chemicals, everything is human food grade ingredients, and there are no interactions of any kind with medications. So when I have a patient on the supplement, on Key Equine supplement, they don't have to worry about, is this going to interact with the medication my horse is on? The other thing that is exciting that was found out through the clinicals that we didn't really understand at first is the mechanism of action. And that is that this is not an antiseptic or an antimicrobial action. It doesn't go in and kill things, but what it does is puts a barrier with its surfactants, the ingredients like cinnamon, clove, and yucca, that are surfactants that bind to all the tissues, to the teeth and the gingival tissue, to put a barrier on there. And what they do is they prevent the colonization of bacteria, of the bad bacteria. And the really cool thing is they don't disturb the good flora in the mouth, which we need. So if we put an antibiotic in a horse's mouth, we're killing everything, even the good flora that the horse needs. Okay, so that's what is so exciting. And then the effectiveness of Key Equine supplement has been astounding. I find that the mouth of the horse, oral care on a horse, is very unique, even from oral care in other companion animals, because it's so hidden. If our dog has tartar, we can open the mouth and look, and we can see reddened gums and things of that nature. But when it comes to a horse, it's such a periodontal disease is a silent killer. So when a horse has problems in their mouth, whether it be malocclusions or diseases, ulcers, periodontal disease, owners most often have not a clue that something like that's going on. I routinely am working on horses a lot of times for the first time for an owner, opening the mouth, invite them to come and look in, and I routinely am hearing, oh my gosh, I can't believe what I'm seeing. It's profound for many horse owners, especially these horse enthusiasts who do care so deeply about their horse, and they look in there and they see these ulcers and shifted teeth and periodontal disease and how that's affecting their horse. And I can often tell based on what I'm seeing, well, has your horse had these problems? And that's when the light bulb goes off for the owner. So with domestic horses, when malocclusions occur, teeth start to shift, heavy contact on different teeth, because the horse is grinding on one side, there is a very strong force, lateral force to those teeth. And when food starts to pack between those teeth, the bacteria that that leaches into those areas further weaken the supporting structures of the tooth. So this is like a snowball rolling down a hill. One malocclusion can start to cause an effect where we develop a pocket, and then the food that packs in that area starts releasing bacteria, which goes down in around the supporting structures of the tooth, and slowly the tooth starts moving through bone. And now we have a widened space between teeth. So it continues to get worse. Oftentimes problems are misdiagnosed in horses. We think of them as behavioral problems, or maybe it's a saddle fit issue, or they're a lameness. And so many times I come across horses when we look in the mouth and examine, and the only way to do that is with a full mouth speculum, a good headlight, and a dental mirror, which sounds funny. We don't think, well, a dental mirror? But it's really difficult to see a lot of areas in there without a mirror. And so the problems that occur in horses with these malocclusions, angles start to change, jaws get offset. This affects horses in a variety of ways. But one of the common effects of these malocclusions is periodontal disease. And there are two forms of extensive care when we talk about caring for teeth in really in any mammal. Endodontics, which is inside the tooth, cavities, and periodontics, peri being the root for around, so around the tooth. And the reason that's so prevalent in horses is because of the constant nature of eruption of these teeth, and they're changing. The grinding surfaces are wearing each other away as the tooth erupts throughout the horse's life. So if a horse has an overbite, which many do, or an underbite, or has had an injury in the body, it can transfer to the mouth. The mouth can shift to one side, the chewing surfaces change, the teeth start to shift, and that's your snowball rolling down the hill. Periodontal disease starts off, innocently enough, as gingivitis. We hear that in human commercials, gingivitis, what can we do? Well, we can't floss our horses realistically, and we can't give them Listerine to gargle with. The two main components for care obviously are equilibration, but what I use routinely in my practice is Key Equine supplement. The inflammation that occurs from these gums, which we have pictures of horses in the clinical trials, the inflammation that occurs is caused from the bacteria that basically harbors in an area, and so the gum reacts, and the bacteria starts to take root and travel its path typically towards the root of the tooth. The gums get inflamed, and that inflammation can be rather painful for the horse. People in gratitude of being educated on the importance of equine dental care. I see horses all the time who have never had dental care. I'll come across 10, 15-year-old horses, and the owner said, I've never had them floated. So that's a great opportunity to teach someone, because if we can teach them, they can teach others. And the overall comfort of the horse starts in the mouth. If the mouth isn't correct, and I see it over and over and over, it is going to affect the horse in a lot of ways. And we see this in barrel horses, race horses, any performance horse that we talk about, correcting the problems in the mouth, correct so many issues. And oftentimes I come across people who have been searching for answers. They're looking for the latest and greatest saddle fit, or the best farrier who comes from 3 states away, or chiropractic and acupuncture. And while there is definitely need for all of these things, the very beginning of many of these problems, the source of many of these problems, can actually originate in the mouth, and that is so misunderstood. So horses of all ages have particular needs. We care for young horses' teeth in a different way that we do a geriatric horse, and they all have needs at different stages of life. And when I perform equilibration on horses and make the corrections needed, the addition of Key Equine supplement to these horses is, I feel, critical, because these are domesticated horses we're talking about, first of all. Most of them do have problems. I often get asked, can you look at my horse to see if they need anything? And it's almost a foregone conclusion that they do. So the addition of Key Equine supplement can help put a barrier up against all the pathogens that occur in the horse's mouth, from misaligned teeth, feed packing. You know, a lot of times there are diseases that can cause ulcers in the mouth. Long-term NSAIDs can cause ulcers in the mouth. Cushing's disease, we see horses with oral ulcers that don't heal. And so there are so many areas that I come across that I am so excited to have Key Equine supplement to give these horses to heal their mouths. And I find it important really at every phase of life, you know, not just for geriatric horses, but even the young horses who are shedding baby teeth, shedding caps, and then the misalignments that occur to prevent periodontal disease from grabbing hold and taking root. I had always struggled with how to treat periodontal disease. You know, we were placing doxyrobe gel, we were trying to put plugs and patches in these areas to try to control, and I never really found any of those to be effective long term. It might be a quick effect, but long term, no effect. So we started with trials in Florida and California, and it was there was a lot of time involved going to these trials. You know, this was in 2009, and I have more patients on this product today than ever before, because I have seen personally, firsthand, what it has done for my patients. It truly is amazing. During the clinical trials, we had some young horses in Sarasota, and these are 3- and 4-year-old horses who are shedding baby teeth. And some of the feed, oftentimes we get a hold of hay that has barbed type weeds in it, foxtail and different types of weeds that will barb themselves into the gingival tissues and create ulcers in those areas. So we had a few of these horses in Sarasota that had this. These are young horses, and they've already got problems. In the trials, we put the horses on Key Equine, and amazingly, going back 7 days later, the healing that had taken place was shocking. It really was. And I see this from day to day in my practice and in the horses that I care for. You know, the one really nice thing about the Key Equine supplement is how easy it is, the delivery system. It's as simple as tearing a foil packet and putting it over the feed. Very simple as a supplement delivery.